Welcome to St. Louis on the Air. I'm Sarah Fensky. HIV used to be a near certain death sentence. And during those scary years when that was the case, the federal government urged states to adopt laws making it a crime to engage in acts that expose people to it. For a time, such laws were even a requirement if states wanted to tap into HIV-related grant money. By the year 2011, 33 states had such laws on the books. Now, the feds swiftly reversed course. For nearly a decade, they've said that such laws are not helpful and may even be harmful. Yet 29 states continue to criminalize knowing exposure to HIV. In Missouri, you could face 30 years in prison for exposing someone to the disease. Yet that could be changing. A new bipartisan effort to repeal the state's draconian HIV laws is underway. And joining me in studio to talk about it is Chloe Owens. She's a justice organizer with Empower Missouri. Chloe, welcome to the show.
Hey, how's it going?
We're also joined today by Nishi Parkinson. She's a community activist and a local mother who herself was diagnosed with HIV in the 1990s. Nishi, welcome to the show.
Hi, everybody. Welcome.
So, Chloe, walk us through the details. What is the current law in Missouri regarding HIV exposure?
So currently in Missouri, we prosecute the transmission or exposure of HIV. It is a Class A felony, so that could sentence someone for up to 30 years to life in prison.
That's basically like first-degree murder.
Exactly. This idea that, HIV, when it first, came around was a death sentence is still something that is on our books today. With that, there are also a few other parts like sentence enhancements for people who are currently incarcerated who expose corrections officers and mental health employees to bodily fluids. There are sentence enhancements for sex workers, where if you are a sex worker under Missouri's current laws, any charge that you get if you are not HIV positive is a misdemeanor. If you are a sex worker who's living with HIV, all of those charges are elevated to some level of felony.
Wow.
So there are a lot of different parts to the law that we're trying to, work on.
I understand that Missouri is one of the states, not all states are this way, where even if you're using a condom during a sexual act, Missouri doesn't really cut any slack for that. And in other cases, too, you don't even have to infect somebody with it. It's just the very act that they could be infected.
Exactly.
How unusual is that in terms of the pantheon of state laws?
It's interesting that it's actually not that unusual. A lot of state laws don't consider intent, whether or not a person is actually trying to transmit HIV to another person. They don't care if you were using condoms or if you are taking, HIV-specific medication, if you're taking preventative measures or anything like that. And it doesn't consider the medical advancements that we've made.
You mentioned the HIV-specific medication. I understand that these days that can actually make a difference in terms of whether or not exposure is even a problem.
Exactly. So for a lot of people who are living with HIV, if you have access to consistent medical care, you're plugged in and you're able to get medication, a pill a day can then reduce your viral load to undetectable. And we know that now, if your viral load is undetectable, you're unable to actually transmit the virus to others.
And yet, under Missouri's law, you could still face a severe criminal penalty.
Exactly.
Nishi Parkinson, as somebody who's living with this disease, are these laws something that are on your mind?
Every day. Not just for me, just for other people around the globe, right? Missouri laws are really thick. They have no wiggle room, no acceptance based on the evidence that we currently have. U equals U is a platform that Prevention Access has afforded the world. Bruce Richmond has afforded the world to know the evidence, use the facts, learn the facts, and do the facts. Like working with individuals every day on the front line, we strategize to look forward to having people living with HIV. 90% of the people living with HIV knowing their statuses, 90% of the people knowing their HIV statuses and their treatments, and 90% of the treatments with suppression rates are low, right? Mm-hmm. So we know it's less likely to transmit HIV to a negative partner. Mm-hmm. And being in healthcare 100% of the time, I've been in healthcare over the last 22 years. I talk readily and available to my providers each and every day. I take that one pill a day because ultimately I want to live, right? I want to be there for my daughter. I want to see her graduate. I want to see those milestones happen for my daughter. I do not want the HIV criminal laws that are happening today to put me in a trauma, right? So I do what I have to do for me. And there's other activists around the world that does the same thing. So wholeheartedly, we're here today to, talk about these difficult things that are happening every day in our legislation.
And what a concern this is.
Yes.
Chloe?
And, thinking about those points that Nishi brought up about meeting that 90%, 90%, 90% goal set out by the United Nations when it comes to addressing the worldwide epidemic. Those are commitments that even our current, administration have made, saying that these are targets that we want to meet. And when you think about what HIV criminal laws do, they make it so that not knowing your status is protection. And when people aren't being tested, when they are afraid of what the impact of the law could be if they know their status, we're not going to be able to reach those particular targets and make that progress for people living with HIV.
So if you don't know that you have HIV and you end up exposing somebody, under Missouri law, that's actually a good defense. Exactly. So people have good reason to not want to be tested, and yet that's the exact thing that could make this epidemic worse.
Exactly.
And as you say, President Trump is on board for this too.
Yeah.
That's interesting.
So, on World AIDS Day, December 1st, it was December 2nd this year, actually. We, read the presidential proclamation, and these are commitments that not only our current president has made, but also when you look at where we're at here in St. Louis, our mayor and also the St. Louis County executive have signed on to meet these requirements by 2030 in St. Louis City and in St. Louis County. How are we going to be able to reach those if we're living under these kinds of laws in our state?
Yes, so what Chloe is talking about, she's actually talking about our fast track city, how we're going to end the AIDS epidemic in our community. We're going to do that by mobilizing. We're going to do that about having daily development meetings to integrate public health for the city and county sectors. And on December 2nd, they all came together to look at this declaration so that we can make meaning and impact in our communities, right? And I currently sit on one of the committees for the fast track cities community engagement. And being on the front line as a person living with HIV, it's meaningful to have those difficult talks, to bring people into care and to know the education behind it and remove the myths. Because stigma kills, right? Wholeheartedly. It changes your thinking capacity because someone can judge you just by looking at you, right? But they don't know your story. So bringing individuals in with a positive social aspect of talking about those things that individuals have contracted HIV in the community, we can make a safe space for them, right? We can have those dialogues and get them in quicker with the medical stance that we have in the St. Louis community. So we want to say kudos to our St. Louis City, our St. Louis County affiliates and CBOs here, our community-based organizations, for lending a hand to make sure that these things work.
Now, Chloe's organization, that's Empower Missouri, along with other activists and several Missouri legislators, they held a press conference last week to raise awareness about some efforts to change these Missouri laws we've been talking about in the 2020 legislative session. And we spoke last week with State Representative Holly Rehder. She's a Republican from R-Sikeston, Missouri. And part of what prompted her to sponsor legislation that would change these laws was hearing from one of Chloe's colleagues at Empower Missouri. That colleague knew that Representative Rehder was familiar with the way drug addiction harms Missouri families in many ways, including in some cases leading to the spread of HIV. Here's how Representative Rehder explained the connection between drugs and the HIV epidemic.
So much of our increase in Missouri is spurred on by the opioid epidemic. So it was definitely a fit for some of the work that I was already doing, as and it's definitely more important today than ever.
Now, in previous years, there have been attempts to modify the state's transmission law. Representative Rehder told us she's hopeful those efforts are finally now gaining the momentum they need.
One, last year was the year before last, we had great committee testimony, and everyone on the committee, Democrats and Republicans, all left after the committee hearing with a unified agreement that, hey, these statutes are incredibly old. They are not scientifically truthful, and we need to get, we need to do something about this. So then fast forward to last year, we had wonderful floor debate where afterwards I had representative after representative coming up to me and saying, hey, I had no idea. This has just been really enlightening to me as to the statutes that we have on the books that are so discriminatory towards persons living with HIV. So, HIV is the only disease that's named in Missouri statute. And so it's just really been eye-opening and educational over the last 2 years.
That's Missouri Republican Holly Rehder talking about why she's hopeful about this legislation updating the state statutes surrounding HIV transmission. And she did also credit President Trump's plan to eradicate HIV in America. We also spoke with Democrat Tracy McCreery, a St. Louis state representative. She told us she was proud to work alongside Representative Rehder towards change on this issue. She said that now that HIV is no longer a death sentence, the state should rewrite its statute to promote public health and not stand in its way.
Everything in our statutes should be doing things to encourage people to get tested and to know their HIV status so that we can eliminate HIV in the state of Missouri.
And Representative McCreery told us that the stigma surrounding HIV has stood in the way of good treatment. That's something she saw firsthand in a previous career.
Back in the 90s, I used to be a pharmaceutical sales rep and had the chance to attempt to sell an HIV test to OBGYNs. And it was very, very eye-opening because I realized that within the medical community, there was a lot of stigma and bias attached to the issue of HIV. So when I was trying to encourage OBGYNs in this St. Louis region to test all of their pregnant patients for HIV, I actually had medical doctors tell me, well, my patients don't need to be tested. I can tell that this is not an issue with my patient population. And that is so not the right way to approach a public health issue like HIV, because we now know that if people know their status, including pregnant people, that there are things that you can do to prevent the transmission of HIV to the fetus, for example.
That's State Representative Tracy McCreery talking a bit about the stigma around HIV, but also, the importance of this bill. And now we've got her and Representative Holly Rehder both introducing these bills. They're really seeing momentum. Chloe, do you feel like this is the year where we could actually finally see these laws repealed or changed?
I really do. I think, we're trying a different strategy as we head into the 2020 legislative session. Some of the bigger issues that we want to see in the law, for example, the concept of mens rea, which is intent. We're meeting with legislators and talking with them about this, building on the education that they already have, and also relying on their expertise that they bring into the state capitol. We're working with a lot who work in the field of law and who understand how, other criminal statutes work. And building on, the things that we've already taught them, thinking about the medical advancements we've made and things like that, we're hoping that if we can get that through and really combine both of those things this session, that we could see real progress.
We're talking to Chloe Owens of Empower Missouri and activist Nishi Parkinson about laws criminalizing exposure to HIV in Missouri. We need to take a quick break. We'll be back shortly to continue this conversation. This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU.
Support comes from the Missouri Forest Products Association, providing more than 41,000 jobs in the production of wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details at choosewood.com.
Welcome back to our conversation about the Missouri law providing severe penalties for HIV transmission and exposure. We're talking with Chloe Owens. She's a justice organizer with Empower Missouri. And we're also talking to Nishi Parkinson. She's a local activist and a mother. And Nishi herself is living with HIV. Nishi, you were first diagnosed in the late 90s. That's more than 20 years ago at this point. At the time, what was your prognosis?
My prognosis was I went in for a regular routine check, right, at my St. Louis County Health Department, where I waited 2 weeks to receive my diagnosis back then because that was the routine process then. And I got my diagnosis, and I really went into a shell, right, because who could you tell at that time? You know, stigma was high, judgment was high in the community. Black and brown people just didn't know how they could access readily and available medical care, which my parents always made sure that my medical care was up to the utmost. But it just took that one unprotected time to have sex with someone in the community, which was my partner. And I contracted HIV.
And this was a partner you'd been monogamous with, but
Absolutely.
he was infected.
Absolutely.
You must have been terrified. I mean, at that
Very
time,
much.
people were dying left and right from this disease. When did you start getting a sense of, wait a minute, this is not a death sentence? I mean, you look great today. You look
Thank
so
you.
healthy.
Thank you.
Has that
Thank
always
you.
been the case?
My healthiness has always been the case, but I think when I met a young woman through my case manager, and her name is Linda Scruggs, right? They went to a TOT called AIDS Alliance. They flew me out from St. Louis. I was there for a week, and I learned a lot about HIV 101, how to accept, how to gain the tools, and be able to be a leader, right? It wasn't easy stepping into a room of the unknown, right? But the individuals in the room catered to us as women, learning about us and that meology standpoint of how we will live, how we will get past this, how will we be influencers in our community. Moving forward, 20 years later, I have been an activist on the front lines for not only me, but for many of people around the world. I am Missouri PWN, Positive Women Network USA, Missouri State Lead, where we believe in building leaderships for women, all women. And our vision is always to be transparent, to be non-judgment, and to accept people for who they are on the front lines. So that's where I am today. I'm a leader.
And in terms of how well you're doing physically, how important is it that you need to keep taking medication and keep continuing to sort of treat this disease?
Yes, treatment as prevention is 100% a way to have a long lasting life, right? I go to see my physicians currently every 6 months, right? So I had a long conversation with one of my physicians that I've been seeing for quite some time, and I really asked her, I said, hey, do you think I can come in once a year now? And she was really like, are you sure? You know, this stuff. She gave me kind of like the third degree, which she was looking for me to, you know, take ownership of my life, right? So now I go in once a year and I get labs done every 6 months. But I don't forget that one pill a day, right? That one pill a day can save my life. It can keep my viral load down, keep my immune system healthy and well, and I can fight off flu and colds just like anyone else, right? I take my vitamin C. I don't exercise as much, but I need to incorporate that in my life, and I continue to be a game changer for people that feel that they can't have hope, you know. So I allow my life to bring hope, energy, and empowerment to people around the world.
Chloe, hearing about how well Nishi is doing today and just how healthy she is that part of what's underpinning this policy discussion in Jefferson City? I mean, we used to treat HIV like it was this terrible thing compared to, say, herpes. And yet now, today, people can live with it just the way they live with many other chronic conditions.
Exactly. And that's, I mean, the real underlying point when we think about this. We are acting as if HIV is, you know, so different than a lot of the other conditions and viruses that people fight with and battle with today. And it's not. It's something that people can live with. People can live long, healthy, robust, beautiful lives with this disease, just like you could if you get the flu, just like you could if you get a cold, things like that. HIV is no particular, as some people see it, weapon. That's not what this is. And people who are living with HIV need to be given the same dignity, compassion, and respect as all other people. And under these laws, that's not what's happening.
Now, we think about these laws as just being things that are on the books and maybe not necessarily being enforced, but that has not been the case here in Missouri. I want to talk about a very high-profile case from a few years ago involving a star wrestler at Lindenwood University. Chloe, what happened to Michael Johnson?
Yeah, so Michael Johnson was a 21-year-old college athlete. He was at Lindenwood on a full athletic scholarship, and one of his sexual partners pressed charges against Johnson for having exposed and transmitted HIV to him. So Johnson ended up being on trial for supposedly infecting 2 partners and exposing 4 others to the risk of contracting HIV. And he was initially sentenced to 30 years to life in prison.
Wow, that's a huge sentence.
It's a huge sentence.
Now, we talked to State Representative Tracy McCreery about Johnson's case, and he was recently released from prison on probation. There were some legal maneuverings going on in that case because people felt that sentence was so unjust. She said the way the state's law currently stands does leave room for these murder sentence type consequences.
It's so frustrating because the way the current law in Missouri reads is in the court of law, it ends up being a he said versus she said situation as far as if somebody disclosed their HIV status or not. And that's just the wrong way to do things. We need to be breaking down the stigma surrounding HIV, and we also need to make sure that we that knowing your HIV status is not a crime. So people knowing their HIV status is actually good for the public, and it's good for public health. So my colleagues in the Missouri Legislature have a chance to update our laws and actually save lives.
That's State Representative Tracy McCreery. Nishi, going back to Michael Johnson's case here for a minute, was this a case that you and members of the community of people living with HIV, was this something you followed?
This was conversations. It was a lot of conversations for our Positive Women Network USA, because we envision a world where women can live with HIV with dignity and respect. And, just having those difficult conversations around his case, it had a lot of question. It had a lot of room for conversation. And for me, being a woman living in St. Louis, I was diagnosed in the late 90s, right? So everybody has sex, right? So consensual sex, and, we exchange phone numbers in the community, right, when we meet a partner. And we don't talk about those things of how many sex partners have you had in the last 6 months? Have you visited your doctor in the last 3 months? Mm-hmm. You don't have those typical conversations. My mom come from a large family of 12, and they had large families that could, women conceive children, and the mother waited at home for the husband to come home daily from work, right? Mm-hmm. They had viruses, they had bacteria, they had infections, they had diseases back then in that era, and people still had sex, right? So what makes today different, mm-hmm. right?
So you feel that way even though, as you were telling us earlier, you were infected by a partner, somebody mm-hmm. that you trusted. Mm-hmm. You still don't want to see them throw the book at somebody who might do that.
Absolutely. I do not want to see that happen to no one in any community, any state, because the laws are so thick, right? Why would someone lose their life for 30 years knowing that they had consensual sex, right? Mm-hmm. It was not reckless. It was not rape. It was not incest of those things, It's not who we are. It's the things that we did that put us at risk, right? Mm-hmm. Everybody in America is at risk of contracting HIV because there's no cure right now, and we're trying to end the epidemic. And stigma plays a big key in reason why people will not come to health care.
And, I think the other thing going off of that is that those situations, it's a consensual act on 2 people. Laws like this place the burden on a person who has HIV, and HIV specifically, when we're not talking about the other things that people can pass to one another. Mm-hmm. Even something that we all deal with and talk about so openly is the flu, that takes more lives every year than HIV does to this day, and has for the last, I believe, 5 years. So, we need to stop thinking that HIV is something very specific on its own to be singled out, when really, scientifically, that's not the case.
A study in the journal AIDS and Behavior looked at 10 years of HIV prosecutions in Nashville, and it found that, quote, persons who were Black were more likely to be convicted of criminal HIV exposure related to a sexual interaction than persons who were white, and also that individuals who were Black received significantly longer sentences than those who were white. Chloe, are there concerns that Missouri has shown similar patterns, or that the book is being thrown at Black people in the way that it maybe hasn't been with others?
Absolutely. I think we can see that in the Michael Johnson case, and that, this was really a he said, they said, and the fact that there was so much reliability on the part of listening to his white accusers, and the ridiculous amount of sentence that he got for what happened. these HIV criminal laws are really just another tool to criminalize Black bodies, queer bodies, poor bodies, brown bodies. And so we know that just as we've seen with other criminal statutes, other laws, and when we think about mass incarceration, this absolutely plays into that. And we don't think that Missouri is any exception to that rule.
Now, we were talking earlier, we played some audio from both Representative Tracy McCreery as well as Representative Holly Rehder. And Chloe, you told our producer that the bill sponsored by Democrat Tracy McCreery is the one that would be your ideal bill. It takes HIV transmission down to a misdemeanor level, among other changes. But because Republicans control the state house, it does seem that the bill being sponsored by Representative Rehder is more likely to move forward and ultimately get passed. What would the Rehder-sponsored changes look like if that is the version that ends up going into law?
Right. So the first thing I want to say is that we're really excited that, Representative Rehder and Representative McCreery are working together and are working with the coalition to, try and get Rehder's bill closer to McCreery's. At this point, though, what the changes would make if Rehder's bill stayed as it was, and that is the one that moved forward and passed, it would bring down some of the current felonies. I believe the highest level felony would then be a Class B felony. It would require transmission, but it would also require for the prosecution to prove the intent of the person that they were trying to transmit HIV to another.
So those would be some good changes.
Yeah. In the end, even though there would still be some felonies, which we definitely don't want to see, having to prove that someone was very intentionally trying to transmit HIV to another person, that is that's a high threshold to meet. And so it does still provide protections that the current law does not.
And just one quick thing for our listeners in Illinois. I understand the law is not as harsh there. Their condom use can be used as a defense, which is not true in Missouri. The maximum punishment is only 7 years in prison. But I know Empower Missouri still sees that as less than ideal. How big of a problem is this nationwide at this point?
So at this point, I believe 7 states have made reforms or repealed some of their statutes. With that being said, we know that for a few states that have completely repealed their laws, we're still seeing people living with HIV being charged under their current criminal statutes. For example, in Texas, we've seen people be charged with assault with a deadly weapon for exposing others to HIV.
So they're getting around the fact the law has changed to still hit people with just as hard of a charge.
Exactly.
Wow.
And so that's why with our efforts here in Missouri, we don't want to completely repeal the law because we want to create protections within that. We don't want to leave it open for people to take so much discretion to be able to continue to target people who are living with HIV.
Chloe Owens of Empower Missouri, I hope you'll keep us posted as this conversation continues. I think there'll be a lot more to come on this year.
Absolutely.
So thank you for joining us today.
Absolutely.
And Nishi Parkinson, thank you so much for being here.
Absolutely. Thank you.
This is St. Louis on the Air on St. Louis Public Radio. That's 90.7 KWMU.
Support comes from the Missouri Forest Products Association. Missouri produces wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details on the variety of products made in the state are at choosewood.com.